case of the red light therapy, there are several modalities, so it depends on the actual indication. Red light therapy is given in various doses according to what the medical concern is or the complaint is. So there are variables. In terms of the light panel, we set the person up in front of the panel depending on what we want to treat. For example, we had a lady with severe alopecia where she lost a lot of her hair because of chemicals that was put in it. So we would have oriented her so that her head would be exposed to it, and we got good results with that. In terms of another device we have, which is the Saluma panel, that is a special device that has red light, near infrared light, and blue light, and is indicated, for example, for acne and other skin conditions, and is also indicated for painful conditions, muscle pain, arthritis, etc. So if it's a condition with the face, then it's placed on the face. If it's a condition on the back, it's placed on the back. If it's a condition on the limbs, it's placed on the limbs. And it's a pretty cool device because it can actually be wrapped around the appropriate area, whereas the flat panel cannot be done in that way. And finally, there is a red light probe. I call it a probe. It's done by QR. And that gives a focused red light beam. And that is quite effective for muscle injuries, muscle pains in small areas, for example, the tendonitis and so, where the light is applied directly in that area. For the light, there are 3 doses, 1, 2, or 3 minutes for the stroke, the probe light. And the Saluma, which I mentioned before, is usually 20 minutes. The panel is going to vary according to the actual indication that it's being used for. So that's red light therapy.